so much. Perfectly on the spot. Dr. Hunziker, our last presentation, and then we roll up our sleeves and we get going here. All right? All yours.
Thank you very much, Mira. Thank you very much for all the other organizers for giving me a short opportunity to show a few slides about who am I and what we are doing. That's Patrick. Was the right one? We also have a lot of stones. We pile them in a very different fashion, and that requires that we build our research institutions on different places. This is the Cabana Margarita. It's at 4,500 meters, so we do a high altitude research there, and this may be just a contrast to see what does altitude on physiology in the two different extremes. And if you combine two different extremes in statistics, you get much nicer correlations than if you have just a narrow span of measurements. I'm not involved in that high altitude measurement though, but let us shortly look where medicine is today. Medicine today mirrors the science of the last century. It has had important achievements in many areas, and it has important limits, and I have no time to go into detail here, but it also has fundamental blind spots. The structure of life at the nanoscale, the function of life at the nanoscale, the understanding of the human body as a multiscale system that only enables life, and understanding who man is and what he is at the fundament of medical practice. If we look at man in different fashion, we treat him completely different. If he's a disposable machine, we will handle our patients differently than if it is a valuable person being. Now, one of the first things that was known about man is that man is beautiful, in particular the female version. Since Vesalius cut up the bodies in Basel 500 years ago, we know more about the internal organs of the body than the light microscopes were invented. We knew more about the microscopic aspects of the body. At the same time, alchemy and chemistry came up, showing us that there is some water and some salts in the body, some macromolecules, some organelles. But this is the last secret in life, which is the nanoscale. High-resolution microscopy, electron microscopy, atomic force microscopy has shown us in the last few decades that there is something in between, which is the nanomachines of life, which are fundamental for the working of man. And it's somehow a secret how medicine could be partly successful without ever seeing this blind spot in the working of the human body. Now, science in the 21st century has changed a lot compared to the last century. We are in the era of nanoscale, in the era of new materials, of the new physics, of the high-performance computing, in the era of understanding complex systems better, in the era of machine learning, autonomous systems and robotics, and in the era of synthetic biology. And so the big question for a doctor like myself is, this sounds like it will have a fundamental impact on the practice of medicine, and where are we going to go? My daily practice is I'm working in an intensive care unit as a cardiologist and intensivist, so my question is, how can we save lives in acute myocardial infarction? And this mainly means that we protect the patient against early ventricular fibrillation, sudden death, against progressive loss of myocardium, against shock states, and against later manifestations of heart disease. So we are doing working on pre-hospital management, reperfusion, shock management, unloading left ventricle, for example, by these implantable miniaturized pumps that deliver 3 to 4 liters of blood per minute by a catheter-based approach. They are implanted into the heart within a few minutes. We are using them frequently to save a life. And this is high-tech. However, this may not be the future, because the future would mean that we eliminate this disease altogether. before we can eliminate, we need to understand it better. And here I see an important role of modeling, predicting efficacy in medical therapies in individuals. And that's why we are involved in computer modeling of heart and circulation to predict if in a given patient with a given disease, our therapy will be effective. Here you see some results, pressure volume loops, relating a little bit to the diastolic dysfunction we have heard earlier on. And I think this is an important direction to go on. Diastolic heart failure, diastolic dysfunction is an important unsolved problem of cardiology. But the future will be in the eradication of such diseases. So the question is, can we eradicate arteriosclerosis, the fundamental biological process which only leads to myocardial infarction and shock, before it happens? And that's why we have gone into nano platforms for cardiovascular disease, and we are already quite successful in depositing such nanomaterials after intravenous injection into the arteriosclerotic plaques of organisms like transgenic mice. Unfortunately, the hurdles, as you have heard before, of the transition to clinic, this is really hard. In particular hard for a small university like the University of Basel, which is 600 years old, but does not yet have a GMP production facility for their materials. Another part of my heart is in my history back in Africa, where I worked 30 years ago. And one of the questions, if you want to benefit society and humans, is to look into poverty diseases. Poverty diseases in Africa is not arteriosclerosis, this is infection and inflammation. And that's why we are also working on nanotechnologies for diagnosing and treating parasitic diseases in Africa. And to find new solutions, you need to jump into the problem. And here you see my doctor, my PhD student, Maurice Mutronigo, jumping to the problems with all the practical aspects, difficulties you see. The water you see is the ideal breeding ground for mosquitoes, and the worms will penetrate your skin if you step into this water to dig out your car. So there are more problems than just killing a parasite. There are infrastructure problems to overcome too. Now, our work is structured in synthesis. We have a polymer chemist working on delivery materials, on polymeric nanomaterials. We are studying nano-bio interaction in a quantitative fashion. We are doing computer modeling of nanomaterials, synthetic materials on one side, on the biologic aspects of proteins on the other side, to understand starting from first principles, what is the exact science of such a seemingly imprecise endeavor like medicine. And what we see is that at the nanoscale, thermodynamics is nanomechanics, so we have something where we can do quantitation, and at the same time we have something where we can do imaging and correlate these two things. Very interesting. This allows us to figure out, for example, which amino acids are involved in the interaction of albumin to our polymeric nanomaterials, and it helps us in understanding and in creating experimentally new things like artificial organelles based on polymeric systems that can be implanted into a cell to deliver new biologic functionality to this cell. This also means the highly interesting interaction of different people from different backgrounds. The last addition in our research group is an Israeli robotic scientist. The artificial organelles were built by an Israeli postdoc who is now back in Rambam in a management position. And just a short slide to a different topic: will technologies save the world? Is there a future for Africa? Somewhat related questions. And we know that this is not the case. In Africa, reconciliation, peace, fair society, sustainable economy, education, healthcare are the steps before you can even apply technology in a fruitful fashion. Nevertheless, I believe that science will shape a new medicine in the coming decades. The era of nanoscale, of new physics, new materials, high-performance computing, complex systems, machine learning, robotics, synthetic biology. This will allow new diagnostics, new prevention paradigms, and a personalized, targeted precision medicine. Human health, however, is more than technology. Thanks for your interest.